Hello, and thank you for welcoming us to the Manchester Health Centre. We are called Keymmunication, and we are an organization interested in helping you. Our group consists of the following members: Jody Cairns, Chanel Gallant, Emily Harrowell, Siobhan Lai, Miriam Syed, and myself, Jessica Salipo. We understand the Health Centre is currently undergoing several changes. We believe implementing our policy at this time will be very beneficial to you. Today, we will have a brief overview of the recent changes your health center has undergone and how this has impacted patient flow. We will discuss the importance of interprofessional communication within a healthcare environment. Then, we'll get into the meat of the presentation, our policy. We will discuss our goals, our action plan, desired outcomes, and how our policy will benefit the Manchester Health Centre. Also, we will illustrate how our performance will be measured. And finally, we will discuss future implications that our policy can bring. We understand the health center is undergoing new renovations, construction of new facilities, and you are implementing a new electronic health record. This has resulted in the closure of hospital units, the reallocation of staff and patients to other areas of the hospital, and unfamiliarity with the new data collection and storage system has overwhelmed staff as they try to adapt to change. These changes have resulted in strained relations among staff, as they are required to work with colleagues that do not understand their roles, responsibilities, and priorities of care. Poor collaboration and communication among the healthcare team causes disruptions in patient flow, as both staff and patients are being transferred from unit to unit. Without the presence and participation of all units, patient flow is negatively affected. Due to frequent changes in staff, there is a lack of familiarity among colleagues, resulting in information about patients not being passed along appropriately, which can lead to duplication of data collection and unnecessary lengthy patient stays. Furthermore, information needed to make important decisions about a patient's care is not shared due to lack of communication, which impacts the well-being of the patient. It is evident the stress of working in a constantly changing environment has led to decreased communication among the interprofessional healthcare team. We believe there is a decrease or lack of effective communication among your employees. What we want to do is increase the amount of communication that occurs between the healthcare team and patients, as well as improve communication techniques in order to ultimately improve patient flow. Interprofessional communication provides open, honest, and transparent interactions, facilitates a positive environment, and builds trust with patients, their families, the healthcare team, and communities. This is why communication is important. According to a study done at the Universities of Calgary and Alberta, it was found that understanding and appreciating professional roles and responsibilities and communicating effectively were the two perceived core competencies for patient-centered collaborative practice. Challenges in communication arise when there are differences in schedules, lack of consistent presence of the healthcare team in one place, and lack of a formal method of communication. So, hypothetically, if there was a solution to these problems, communication wouldn't be such a challenge. Improved communication and collaboration as a result of implementing a simulated training program to train future healthcare professionals on how to work effectively within teams, including communication strategies, has resulted in better delivery of care, while failures in communication have resulted in medical errors and negative health outcomes, including death. Communication allows members of the healthcare team to collaborate in decision-making and combine knowledge and skills to provide optimal health care for patients. If our policy is successfully implemented, our goal for the health center is to increase the collaboration and communication of healthcare professionals with patients, their families, the community, and with fellow healthcare providers. This in turn will allow for an increase in the efficiency of patient flow into and out of the health center and into the community. To reach these goals, we have two methods. Firstly, we will implement a biannual workshop teaching effective communication methods to ensure that the healthcare teams work efficiently and effectively when collaborating and caring for patients on a daily basis. Secondly, we will implement daily interdisciplinary rounds, allowing healthcare team members to discuss patients and their treatment plans. These rounds will allow the healthcare team members to be fully informed about a patient's health status on a daily basis. It will also allow the healthcare needs of patients to be met quicker, contributing to improvements in discharge and improved patient flow. Our plan is as follows. We will collect data on the health center's present patient flow, interprofessional communication, patient care, and discharge conditions. To collect our data, we will gather statistics on the number of people coming into and out of the health center, average duration of stay, and post-discharge location of patients. We will pass out satisfaction forms in which patients can describe their overall experience during their hospital stay. We will also send questionnaires to healthcare providers on how healthcare members feel about the current communication system. Next, we will educate health center staff on our new policy. We will have a biannual communication workshop in which healthcare providers will learn to effectively and clearly exchange valuable information during client handovers, develop methods of collecting and storing data for ease of access. They will learn to appropriately involve patients and their families in their plan of care and take their needs into account. And they will learn to collaborate with external healthcare facilities which can help meet patient needs. A training program like this can improve self-efficacy, attitude and motivation in regards to working within an interprofessional healthcare team, as well as increase communication skills and teamwork skills. Last but not least, we will have daily interdisciplinary rounds where patients and their plan of care can be discussed. As well, healthcare team members will have a chance to know each other, or get to know each other, and create a positive work environment. The following are our desired outcomes from implementing this policy. Healthcare professionals will attain important skills required for delivery of optimal care. The healthcare team will function well together due to frequent collaboration. Daily communication between staff members will allow all members to remain updated about patient health status, provides an opportunity to discuss plans of care via face-to-face interaction, as well as combine findings to determine solutions allowing for more effective delivery of care. There will be increased communication and data exchange between healthcare professionals during client handovers. There will be increased collaboration with patients throughout their stay, meaning the healthcare team will be knowledgeable about the patient's choice and the patient's condition. Increased communication and patient transfer will allow the healthcare team to make the appropriate referrals to other hospitals, agencies, and community resources that can meet the needs of the patient upon admission, allowing for effective patient flow. Lastly, reduced medical and communication errors will reduce opportunities for potential medical and communication errors. Here are some benefits to our policy. Our policy is cost efficient, as improved patient flow will allow the hospital to use its resources more efficiently and for the most patients possible. There will not be an overuse of resources as a result of lengthy hospital stays. Daily rounds will allow the healthcare team to be updated on patients' health status and will allow team members to collaborate on the provision of care, ultimately improving patient flow. There will be decreased duplication of data, which will help to save time as well as reduce hospital stays, ultimately saving resources. Healthcare team members will attain thorough understanding of one another's scope of practice, which will be beneficial when formulating patient care plans. Most importantly, the well-being of patients will increase as they will be continuously involved in their plan of care. We will determine the success of our policy by measuring the following. We will assess patient flow by measuring the length of time from patient admission to patient discharge on each unit. After the implementation of our policy, we can assess how patient flow was impacted. Also, we will assess interprofessional communication and collaboration prior to implementing our project. After the implementation, we will assess if improvements have been made. We will have observers who will be responsible for overlooking communication that occurs between the interprofessional healthcare team, the patient's families, and external resources. We will also utilize the information we have gathered via statistics, patient surveys, and questionnaires. Let's look into the future. Our policy will save money in the long run, as overdue stays in hospitals will decrease, more beds will be available, and fewer resources will be used. It has been proven that communication between healthcare professionals results in decreased hospital stays and hospital readmissions, as the healthcare needs of patients are successfully met. Implementing a workshop to teach effective methods of communication will equip healthcare team members with the essential skills needed to provide optimal care for patients. Increasing the bond and relationship between healthcare professionals will allow the team to work well together and understand each other's scope of practice. This will increase team morale and in return will increase the quality of their work. Overall, the healthcare team members will be more effective in the delivery of care, and the health center will gain a positive reputation as being known for excellent patient flow and optimal delivery of care. We hope the presentation has been very informative. We understand the health center wants to provide quality health services and facilities that maintain and improve the health of our community. We also understand you want to build strong collaborative relationships with internal and external partners and include patients in the provision of their care. We feel confident our policy will support you and allow you to meet your mission and vision. By implementing this policy, we can ensure you will assist in providing a positive and smooth transition as the health center undergoes these important changes. Thank you for listening and thank you for taking the time. Does anyone have any questions?